Okay, this is the introduction to pathology for students who are undertaking orthopedic and trauma and diploma certificate course. And today we are going to focus on introduction of pathology so that you can familiarize ourselves with what are we going to study about pathology. And we have a overview of pathology per se. So uh, what is pathology? Pathology is the opposite of physiology. Suffering or disease, then the analogy is the study. So it is the study of diseases, changes in structural functioning during the body in cases of diseases. So it was derived, this one was derived from a Greek word means pathos, which means suffering. And Rogers means study. So it is the scientific study of structural function of the body in a disease. So these are the fathers of pathology, like father of clinical pathology is Paul Ehrlich in the year 1854 to 1915. He was a German physician. He had a Nobel Prize working in immunology, and he described NBAT testing for urologen staining techniques for cells and bacteria, and then the foundation for hematology and clinical pathology. So we also have the father of explorative cytology, George N. Lived in the 1883 to 1962. He was an American pathologist who developed pap tests for diagnosis of cancer of uterine cervix. We have people like father of CPS, Giovian Morganin, lived in 1862 to 1771, and he was an Italian physician anatomist who introduced clinical pathological methodology in the study of diseases correlation with clinical findings with findings of post-mortem examinations. Then you have father of museum in pathology, John Hunter, lived in 1828 to 1793. He was a Scott Science, regarded as the greatest science anatomist of all times, who established a first ever unique collection of pathological specimens that later resulted in the Ontarian Museum of the Royal College of St. John's in London. We have a father of brand transition is called Carl Duster. We have a father of cellular pathology, Rudolf Victor. So those are one of the great people who contributed to what we are running today, and we have to respect them because they made a lot of contribution. So there are various subdivisions of pathology. We have human pathology being the largest, and then this human pathology is divided into general pathology and systemic pathology. So general pathology is dealing with the general principles of the disease, whereas systemic pathology deals with the systems of various organs and structures of the body, like respiratory, cardiovascular, skin, euro system, gynecological system, like reproductive system, gastrointestinal system. All those ones are examples of systems in our body. So there are other subspecialties in pathology like histopathology, which is a surgical pathology. Then we have a forensic pathology and autopsy worker, and then we have the cytopathology. And then we have another specialty is hematology. Another one is chemical pathology, immunology, experimental pathology, geographical pathology, and medical genetics, and molecular pathology. So there is various histopathology, hematology, and all those ones. So what is histopathology? It is a branch of pathology which studies the tissues sections. This one deals with dissecting various tissues of the body so that you can understand what changes they take place when somebody is sick. The tissue undergoes various steps before it reaches examination. Next to examine by microscope, So, and to achieve this one, it is important that tissue must be prepared in a manner that it is sufficient big or to be examined in the microscopy, so that the structures maintain what you are supposed to do and be able to differentiate. So there are very important things in preparation of tissues and during histopathology. So what is clinical pathology? It's a branch of pathology dealing with the study of diseases and disease processes. For example, chemical, microscopic, and histological examinations. You examine the chemicals, you look microscope, and also the serum uh, of these things. Then we have hematology. This is the branch of medicine involving standard treatment of the blood, like blood transfusion, platelets, paralysis, packed cells, all those ones, stem cells in the blood, all those ones. So the introduction to department of histopathology is the department of clinical laboratories used to study of different types of tissues. And this one is based on various basic like processing, how do you process these tissues, gross tissue processing, embedment, cutting, and what you call staging, immunochemistry, especially in cytology and cytogenetics. So the Greek word is histo meaning tissue and patho means disease, suffering. So it refers to a microscopic examination of tissues in order to study the manifestation of diseases. So histopathology refers to the examination of biopsy or surgical specimen by a pathologist. And after the specimen has been processed and histological sections have been placed onto the glass. So the number one is how do you process these specimen tissues? Take the history for histology. Okay. Then boom, you take an X-ray, an outer space concept form. You have to take a concept form from the somebody who wants to take their specimen. You study things like fluids, body fluid like semen, ammonium, amniotic fluids, cerebral spinal fluids. So gross section, this is gross anatomy. It has specimen are inspected with their eyes. This one you look with the eyes, then you make diagnosis for further. Then you can take some of it for further examinations. So tissues are saved when you correct the tissues for different purposes, like the liver, spleen. All of them are various colors coding. Like yellow, this is where the liver and the liver is good. The green is the routine one for all specimen, and then white is for bones, and the gray for skin, and pink is for lymphatic nodes. So tissue processing, fixing, you have to take the tissue into the paraffin. The procedure is very tactics, and then you have to dry. How do you clean it? All these ones are very important. So tissue is infiltrated with like embedment agent like paraffin. This tissue is always automated for the range of volumes of tissues. And then automation consists of an instrument that moves the tissue around the various agent on the present time scale so that it is automation, so that it is able for what? For standard purposes. So this is an example of a bench here, histology, equipment. You can see this is a first centrifuge here for various functions. These are about various things for checking histology. So embedment is orientation of tissue in melted paraffin, which provide a firm medium for keeping all part of the tissue intact. The temperature paraffin is 50 to 60 degrees Celsius. Instruments are like embedment stations. Then there is cutting, use microton, used to cut about 3 to 5 microns. Then you have hematoloxin for H and E, and SINO for counter hematoloxin, and then you stain the nucleus. This purpose for staining the nucleus and the cytoplasm. Then this is another bench. You can see those people are very busy. They are doing a test for investigations. This is a laboratory. There's another in either laboratory. So immunochemistry is another branch of a specialty. This is where you study about immune reactions like antibody antigen reactions. You study things like cytokines, chemokines, toll-like receptors, B lymphocyte, all those one changes during a disease. So clinical diagnosis and distinguishing diagnosis of tumor histogenesis can be used to locate a particular cell or protein, can be used to identify a cellular event like apoptosis. Apoptosis is a programmed cell death which naturally occurs in our body. So we can see this is a laboratory where people are working, a very busy, a very decent laboratory. People are working, they're analyzing results and presenting for various reasons. Then you have specimen staining requires when this one is required when diagnosis is not identified with the age and the staining. Some of these things used are connective tissues use something called rapid trichome. Then nuclear, you use methyl green pyrroline. Then carbohydrate, you use PSA and PSD as the stains for staining carbohydrate. Consider it's a very good laboratory. The sinks are there. The infection control well leveled is done. This is the staining area. This is the staining area of a laboratory. Good. So, cytogenesis is the study of chromosomes and its abnormalities like chromosome number, structures, functions, behaving relations, gene inheritance, and the organization and the expressions. This type of conditions can be either due to gene deletion or inversion, translocation, or addition or insertion of another gene. Then you have type of specimen like you get the blood, you get the bone marrow, amniotic fluid. Then the procedure is like karyotyping, gene branding, and fish. Other types of the procedure where you do when you're doing steps of staining. So you can see this another pathology. You can see the records there, how these people have done the records and in the laboratory. So let us see cytology. Cytology is the study of the cells and to infections of malignant or malignant stages. Then you have the two types of samples. You have line for pap smear. Then, for example, if you want to do the service changes during gynecological aspect, cancer of the cancer of the cervix. Then you have non-gynec fluids like body fluids like spine, green to urine, pericardial fluid, acidic fluid, and the synovial fluid. All of them are examples of fluid for study. Then we have a procedure done on this one is FNAC and FNVB. Those are the type of procedures done on these cytological cells. Then you can either train staining that like a fast and dry rapid and Jameson or H and E as a type of staining. So you can see that's a very organized laboratory again. People are busy there, they are recording, they're doing their wins in a very good organized manner. So a semen, a fresh sample of semen is examined for liquefaction, motility number, and morphology. This one is very relevant for the purpose of studying infertility, and infertility is a big problem in our setup currently. So element of study, you can study the color, quantity, liquefaction, and various pH. So testing data, you can, it's very detailed in written information for the purpose of artificial insemination, or you can study anti-sperm antibodies. It's a very decent organized laboratory for study. You can see those people are there, standing there very comfortably. Good. And that is the end of today's lesson about introduction to pathology. Thank you very much for listening to this.